I am joined by some of my colleagues in the state legislature. We're going to ask them to come forward at this time and give us 1 minute to make comment. All right, so we're going to ask first Nan Orrock, my colleague in the state senate, who is a national expert on these issues of health care delivery. Senator Orrock.
Thank you, Senator Ford. We come here today to say that we will not stand silent while low-income people are pushed to the curb and denied access to a Grady card because they're not poor enough. Across this nation, we have long since departed from covering people at 100% of poverty, 120% of poverty. Those are decades-old standards. Families today are more threatened than ever with their jobs, their income, their very ability to stay in a home and keep a roof over their heads. This community was made promises that Grady Hospital was going to be transformed, that millions of dollars of private sector money were going to flow to Grady, and Grady was going to uphold its historic mission. Grady was going to uphold its historic mission of being the safety net hospital for our region's low-income people in DeKalb and Fulton. The policy that the hospital is announcing is a policy that goes in the wrong direction. People will die. It is also penny-wise and pound-foolish. When people are denied basic access to health care for the preventive steps and the medications that can keep them stabilized, their health will deteriorate. They will arrive at the emergency room door with flashing lights, with a full-blown stroke, with a full-blown heart attack, with a full-blown health crisis, which will cost us far more than allowing people to have their basic human right of health care here in Grady Hospital. We're deeply concerned. We call on the leadership of this community to rally and bring the message that there's a better way. When we talked about fixing Grady so Grady could survive, that conversation did not include kicking people out of this healthcare system. But that is what we're faced with today. If this leadership at this hospital acts on the proposal, they've done the PowerPoint on it. They're voting January 5th. Now is the time, here on the eve of some of our great holidays, where we come together and celebrate family, where we come together and celebrate community, where we work for a new year, we face standing silent or speaking out and saying, this policy will not stand here at Grady Hospital. We will not stand silent while you kick people out of this health system who have nowhere else to go.
Thank you.